Also welcome our full committee chair, Mark Takano. Thank you for being here, Mr. Chair. Approximately 8 weeks ago, the media began reporting on a string of concerning incidents of patient harm and professional misconduct in VA medical facilities. In August, a former VA pathologist in Fayetteville, Arkansas, was charged with involuntary manslaughter, fraud, and making false statements in an attempt to conceal years of substance abuse. Over his 11-year tenure with VA, he is believed to have botched diagnoses for an estimated 3,000 veterans, some of whom died. Authorities are also investigating at least a dozen suspicious deaths at the VA hospital in Clarksburg, West Virginia. Medical examiners have now determined that 3 of these veterans died of homicide by insulin injection. And early in September, a veteran receiving end-of-life care at a VA nursing home in Atlanta was bitten by ants more than 100 times before facility staff finally moved him to a new room and took action to address this infestation. These reports are sickening. Over the last 2 months, we've also received a steady stream of reports from VA's Inspector General identifying appalling VA quality management failures in several other locations. For example, last month, the IG reported on multiple leadership failures at a VA facility in Vision 10 in the Midwest, which allowed an ophthalmologist to perform substandard surgery and laser procedures for 2 years. This doctor regularly took hours to complete cataract surgeries that should have taken less than 30 minutes. The facility director and chief of staff repeatedly dismissed concerns that were raised by other staff members. Although these 2 facility-level leaders had the responsibility and the authority to remove the provider, they instead chose to disregard the patient safety risks. The reason? According to the IG, the ophthalmologist's spouse was also a surgeon at the facility, and leaders worried that terminating one would entice the other to resign, leaving the facility with 2 physician vacancies. In the end, as a result, several veterans were referred to community care for further treatment to resolve complications arising from this surgeon's care. It would be easy to dismiss any one of these cases as just an isolated incident or just one bad apple. Collectively, these cases speak to wider problems with VA's ability to identify clinicians who are negligent, abusive, or committing criminal acts and prevent them from practicing. The VA's got to do better. Today's hearing will explore several critical questions. What red flags are VA facilities missing, overlooking, or choosing to ignore when they hire and employ clinicians? When concerns arise, why aren't medical center officials investigating in a timely manner? And when concerns are substantiated, why isn't VA reporting them to the National Practitioner Data Bank, the NPDB, and to state licensing boards in a timely fashion? As today's hearings will make clear, far too much responsibility and authority has been placed at the local level. The Veterans Health Administration and its VISNs are doing far too little oversight to ensure that facility-level leaders understand and are complying with policies for ensuring proper patient care and safety. Instead, VA's pervasive lack of accountability is leading to patient harm. That's why we've convened today's hearing. Veterans and their families deserve answers. They need to know that the VA is upholding its moral and ethical obligation to deliver world-class health care. This is the promise our nation made to those who have served, and our heroes deserve nothing less than that. This is not new territory for VA or for this subcommittee. In fact, 2 years ago, General Bergman chaired a subcommittee hearing on this very topic. One of our witnesses, Dr. Gerard Cox, testified at that hearing. Among other things, Dr. Cox promised that the VA would update its policies related to credentialing and privileging, improve the timeliness and reporting to the NPDB and state licensing boards, expand NPDB reporting to nurses and other types of clinicians instead of just physicians and dentists, and establish a new VISN-level compliance process. As you'll hear today, none of these actions have been made since our subcommittee's last hearing on this topic. I'll say that again, the VA hasn't taken any of the actions that it promised during that hearing in 2017. The string of incidents over the last 8 weeks should serve as a wake-up call. No one here would deny veterans deserve any less than that, but we must do better for VA employees who are brave enough to speak up when they're concerned that a colleague's clinical incompetence, their impairment, negligence, or misconduct is putting veterans' lives at risk. As the IG found in the case of the ophthalmologist in Vision 10, facility leaders repeatedly ignored concerns raised by other clinicians at the facility. The indictment of the VA pathologist in Arkansas states that colleagues complained to facility leaders repeatedly that the doctor appeared to be intoxicated while on duty, both before and after he completed an inpatient treatment program. In both cases, it took years for facility leaders to remove these providers, and in the meantime, our veterans suffered. So it's not enough for VA leaders to sit here today and pledge policy changes. They've done that before. We need to see that VA is as outraged as we are, and that leaders at all levels will be willing to walk the walk. We must see a fundamental cultural transformation. Something must be done to make VA a place where employees at all levels feel they have psychological safety and to be able to sound the alarm. Employees need to know that their concerns will be taken seriously, that there's a sense of urgency to address these concerns as soon as they arise, and that VA is acting swiftly to guarantee these issues don't occur again in the future. Their lives depend on it.